Good afternoon and welcome to St. Clair County EMA for our daily briefing. Here again today, joined with County Board Chairman Mark Kern and our dear friend Sam Behrman from the Health Department.
Hi, thanks for having us again today.
You're getting a little like you're wore out, and I understand why.
Well, like we said, it feels like Groundhog Day. We wake up and the same song's playing on the radio and we're doing the same thing over and over again. But we're happy to be here. As we've done in days past, the numbers that we will report to you today are St. Clair County residents that have been tested. And as of today, we are at 806 residents that have been tested, 156 positive, which is an increase of 41 since yesterday. And that includes both male and females from the age range of 30 all the way up to 90. We are at 533 negative results with 117 still pending. We are at 9 deaths, which we are reporting an additional one from yesterday, and that was a female in her 90s who did have underlying health conditions. For state totals, we are at 87,527 that have been tested, 17,887 which are positive, which is an increase of 1,465 from yesterday, and we are at 596 deaths, which is an increase of 68 from yesterday. And as always, our thoughts and prayers go out to the families who have lost loved ones, as well as the medical providers that have taken care of them. One question I would like to address that has been coming through on the Facebook Lives that a lot of our viewers have had questions about is numbers for recovered patients that they have seen that other counties have been producing numbers for. What I would like to clarify is when they say recovered, that simply means the number of people that have finished their 14-day quarantine period. Because as we know, the 14-day quarantine period is a minimum. You could still have symptoms past 14 days. So the 14-day quarantine period is simply what they're referring to when they say recovered patients. That's how many people have completed that 14 days. Now I will turn it over to Chairman Kern for his update.
Thank you, Sam. So with Sam's numbers today, we have tripled the number of COVID positives in St. Clair County since the 1st of April, over tripled. So on this Good Friday, it's important to just continue to remember to check on your family, your friends, your neighbors, and practice all of the hygiene and the social distancing that we've preached about every day. The zip code reports today, we have 2 new zip codes that we're adding to the report because they have now gotten over 5 COVID positives in that particular zip code. So in 62203, we have 6 COVID positives. In 62206, there are 11. 62207, there are 6. 62208, we have 12. 62220, we have 7. 62221, we're up to 18. 62223, we're at 14. 62226, we're at 21. 62258, we're at 8. And 62269, we are at 16 COVID positives. So as the numbers continue to grow, it becomes even more imperative that we stop the spread of this virus. Joining us today is Candace Cross. Candace, welcome. Candace is the CENTCOM West PSAP manager. Yes. So how are telecommunicators responding during these changing times, Candace?
Our telecommunicators are just like every other citizen. They are aware of the virus and they're taking the necessary precautions needed to keep ourselves, our families, our coworkers safe. We were provided with the N95 mask, which we're wearing in public places when we go out, and just doing what we can to stay safe without catching the virus.
Because, you talk about someone who's essential. The telecommunicators are an essential cog in this wheel. You're responsible for dispatching,
yes,
correct? All of the police, fire, and emergency agencies. And so it's imperative that you are healthy and that your people are healthy. How about mental health? How is that working, Candace?
As far as mental health goes, we are all trying to help each other. It's hard when you have some people who have depression in your family, so you deal with home, plus you deal with what's going on at work, and we're all just trying to keep each other at a nice, normal level.
So you are a family at your PSAP.
We're very close, yes.
So do you receive a lot of calls about the violations of the governor's order telling people to stay home and not gather, or businesses that are opening when they're not supposed to?
We are receiving calls about violations. Now that school is out, we have kids that are standing around in their neighborhoods gathering. Some people are in the parks longer than what they need to be. We're receiving calls from citizens reporting their neighbors having more than 10 people at their residence, having parties or loud music, and not social distancing themselves.
So at that point, you're dispatching police agencies to those areas,
We
and
are.
the crowds are being dispersed, and in some places, tickets are possible for people.
Yes, it is.
So how's your call volume going? Is it pretty consistent, or has it risen during this epidemic?
Our call volume has pretty much decreased. It's more so now the type of calls that we're receiving now. We're receiving more calls of domestic violence. We're receiving more medical calls with citizens having flu-like symptoms or having signs of having the coronavirus. We're receiving more calls about depression, anxiety attacks, and people having suicidal thoughts.
What about unnecessary calls? Do you have people that call you with symptoms and ask you to diagnose them over the phone, or?
We do.
And is that normal, or is it more so now?
It's starting to go down now. In the beginning, we had them calling us constantly asking those questions, but now it's down because we have to let them know we're not doctors. We can't diagnose you. You have to actually go to the hospital to be told whether or not you have the coronavirus or not.
And they can they should call their medical provider.
Yes.
And there are many websites that list symptoms and what people need to know about COVID-19.
There it is.
So do you have any success stories that you'd like to share?
I do. We actually had a telecommunicator who went above and beyond the call of duty for a citizen. This citizen, her telephone service had been disconnected, and she didn't have any food. Her electricity had been turned off. The telecommunicator was able to contact the village hall, which was able to deliver food to her residents. The police department responded to help her. We also had that telecommunicator contact the electrical company where her electricity was restored. Their priest of commitment in that village also had her telephone services restored. So they all did a good job working together.
When St. Clair County has a strong community when it comes to banding together, I think we're like none other.
Yes, we are.
So you've got protocols when you take a 911 call and you go through that list of questions. Have they changed during this pandemic?
Yes, what I've noticed mostly is that the wording has changed. Where we would used to tell a rescuer to get to the patient and get down and check and see if they're breathing, if they feel any air coming from them by putting their face next to that patient's face, we don't tell them that anymore. Instead, we don't want them to pass on the coronavirus to them if that is the case. So instead, we now tell them to check and see if the chest is rising or something of that nature, but instead of telling them to get face to face.
Candace, we appreciate you during this time, you being on the front line. Herb, you got anything?
Yes, of course, Candace is one of our PSAP managers. We're fortunate here in St. Clair County to have a strong 911 system, and I can say that because of people like Candace and her staff. Tina Joaquin, the PSAP manager at the other county, PSAP here in Belleville. We have 4 in the county, 2 the county operates, and we have 1 in Belleville and then 1 in O'Fallon. And St. Clair County is, like I said, very fortunate to have a strong 911 center, and I know the calls that these men and women do on a daily basis. So, Candace, I appreciate everything the staff does, and you coming in today, taking time to kind of relay those stories, that success story. When that came across my desk, I like seeing those kind of stories.
All right, me too.
Thank you very much.
Thank you.
So now we're fortunate, as every day we try to get a medical professional on this program, and today we're proud to be joined by Dr. Daniel Normansell. Dr. Normansell is an emergency room physician at St. Elizabeth's Hospital, HSHS. Welcome to, we appreciate you being here. So let's just dig right into this. Do asymptomatic people ever show symptoms, or do they always stay asymptomatic?
Well, thanks for having me on. So the COVID-19 is a clinical syndrome that consists of typically a fever and some respiratory symptoms. The majority of people have some symptoms. they can be very, very mild, and a person may not even seek any sort of medical attention for it, or they can be very, very severe. The concerning thing about the coronavirus, like other viruses, is that sometimes you can pass this virus on at the very, very beginning of your course of illness, first 24 hours, maybe even somewhat before you have some symptoms, and then you're most contagious the first couple days of contracting the virus.
What are the most common symptoms that you're seeing?
So in the emergency department, we see kind of the full spectrum of this. We see people that have very, very mild symptoms. They don't qualify for testing and are sent home with the instructions to self-quarantine. I have a general concern that there's probably a lot of people that have symptoms that are very mild and don't seek medical attention, or have followed the instructions and have done some sort of telemedicine consult, or have called their primary and chose not to come to the emergency department. We also have had, and especially this last week, an uptick on some very, very sick people that have this clinical syndrome and are decompensating to the point that they need to be resuscitated in the emergency room, admitted to the intensive care unit.
So we see positives every day, but there are also negative tests that come back. Are those negatives maybe allergy related? Is the other flu bug that we normally fight, is that still going around? Is that still an issue?
So in general, this time of year, and when we look at kind of the graphs for influenza, our influenza cases are going down this time of year. The coronavirus cases that we're seeing, the COVID-19 is, like I said, the clinical syndrome, and there's a test that goes along with it. And like all tests that we do in the ER and in outpatient setting, they're not 100%. So some of these can be false negatives. Some are, the testing that we have has a low amount of false positives. So most of the time if it's positive, it's a true disease. But there's some that are false negatives.
So when do people know if they have these mild symptoms? How do they know they've recovered?
So it's a clinical syndrome, so it is based on your symptoms. So right now it's not necessarily based on any testing. Like the majority of viruses, like influenza or any common cold, signs that you've recovered from the virus would be if you no longer have a fever for typically 3 days, and that's without fever-reducing medicines like ibuprofen or Tylenol. Typically your symptoms then would have had to get better, your respiratory symptoms as well. So the fever gone down, the respiratory symptoms resolved, and then we're also putting a time frame on it. So 7 days typically from when the symptoms started would be the minimum.
And so at that point, you should always do social distancing, you should always practice good hygiene, but are they, at that point, are they still in danger of giving this to someone, or is that past?
So this is a very serious disease because of how prevalent it is in the community, and especially as we saw by the numbers this week, the prevalence we're seeing. So it's here in the community. The recommendation to self-quarantine if you have symptoms for 14 days is the most reasonable approach to this. So 14 days, if you're not an essential worker, a quarantine is certainly reasonable. For essential workers, and this is including myself as a healthcare worker, the recommendations of if the symptoms have improved, the fever has gone down, it's been 7 days since the onset of symptoms, and then you take precautions, going back to the workforce is reasonable at this time.
So what about when people have symptoms and they're touching surfaces? How long does this virus live on particular surfaces?
So we are learning more and more about this virus every day. It's similar to other coronaviruses, but it is different. The information that we have so far, and it's changing daily, is that it's somewhat similar to other coronaviruses where it can last on some surfaces as little as 3 to 4 hours, some surfaces up to potentially a couple days. So surfaces like plastic and metal are going to potentially have the virus on them for a longer period of time.
So, the metal that it's shortest is copper, and then if you have a plastic or a stainless surface, it can be 2 to 3 days.
That's probably going to be
And so
longest,
people
yes.
need to practice that disinfecting in their home
Correct.
environment.
I mean, hand hygiene and, like you said, disinfecting things is the best way to keep yourself safe.
So we hear a lot about when people die or pass away because of COVID. A lot of times they talk about underlying conditions. Can you talk about what are underlying conditions? I mean, define what they are for people to know if they are at higher risk once they contract COVID.
So for any infectious disease, we look at the populations that are getting sick, and we try to figure out who's at most risk for getting this infectious disease. This coronavirus, is very, very contagious, and we've seen that it tends to pop up in areas where populations are densely packed. You're seeing it obviously in New York City. We're also seeing it in our community in places like nursing homes, in places like mental health facilities or group homes, places where people congregate, even at things as simple as small family gatherings where you've had a large group of people together. So those are by far the most at-risk population, and so that's why it's important to stay at home and practice social distancing. The other populations, which we would expect with the vast majority of any sort of infectious disease, is going to people that have chronic medical illnesses. So people with heart disease, lung disease, cancers, on chemotherapy, some sort of immunodeficiencies, patients who are requiring dialysis, or patients who have received organ transplants or on medications that maybe make them more susceptible to this disease. It is concerning that we've seen patients that do not have chronic medical illnesses, that are young, healthy people who have been severely affected by this disease and are in ICUs currently being resuscitated. So that's something that is, we see it in the older people and the people with medical illnesses, but we're also having a pretty wide range of people who are becoming very ill from this.
What is the recovery time for someone who actually is checked in the hospital that is diagnosed and found to be COVID-19 positive?
So from what we're seeing, and the numbers are changing every day as we're getting kind of more accurate numbers, but it's still a minority of people that are being admitted to hospitals. Most people are being able to be treated as an outpatient. The folks that are coming into the hospital, they are coming in with kind of a wide range of symptoms. Some have mild shortness of breath and kind of mild oxygen requirements. Some have severe oxygen requirements and have to be put on the ventilator right away. So in the emergency department, we're seeing that spectrum of patients. And the spectrum, the ones that are just requiring a couple liters of oxygen are being admitted to the hospital. And sometimes they do decompensate relatively quickly with this disease. The folks that are immediately put on a ventilator, we've had success, or some of these have recovered and gotten better, but it takes time. When we look at ICU utilization and how many days people are on ventilators, sometimes people with other conditions can be on 2, 3, 4 days. Some of these folks are requiring a couple weeks, if not longer. And being on a ventilator for that amount of time then requires a significant amount of rehabilitation afterwards.
So how are the loads running? You're able to keep up now? I know you're working long hours.
Yeah, so in the emergency department, unlike a lot of things that have shut down, strokes have not stopped, heart attacks have not stopped. There are other emergent medical conditions that people are seeking care, and and are a little concerned too when they're coming to the healthcare arena for their emergent medical condition because of the coronavirus that's out there. We are doing a really, really good job at St. Elizabeth's being able to isolate and keep our coronavirus patients protected and keeping other people protected as well, the other patients. So the volumes are manageable for sure. Our resources right now, we have enough resources right now, and we're just working hard every day to keep people healthy and to take care of the folks that we can.
Great. Herb, do you have anything for the good doctor?
Sure, Doctor. Thanks for coming in today and sharing that information. Just a couple of questions that we get all the time. The staff in the emergency department, you get to work with them, and it's a close-knit family there. How's the nursing staff holding up under these circumstances?
Yeah, so I think the nursing staff, as well as the physician staff and everybody who works in the emergency department, is actually coming together as a team and really working to help all of the patients that we have in the emergency department. I mean, things it takes a considerable amount more time to take care of the patients that have coronavirus. So that's a learning curve for the nursing staff to have. To make sure that they're using, and the physician staff using their personal protective equipment. The most important thing for a healthcare professional is to be able to keep themselves safe so that they can continue to take care of their patients. And so there's lots of discussion and there's collaboration on what's the best way to keep healthcare professionals safe, and whether or not that, regarding personal protective equipment, what they do with their home life as well. And then also there's certainly a component of mental health that healthcare professionals are dealing with on their own, anxiety-related things about taking care of these folks, and people have really come together really, really well to help these patients out.
Good. Another question we get quite frequently, and it's a $64,000 question. People wanting to know, is this thing peaking soon, or is this going to spike again? In your professional opinion, you have one on that?
Yeah, so in the models that we're seeing, when they're talking about a peak, and then we talk about what we can do to prevent a peak, the peak is based on kind of resource utilization in our area, and the idea of doing social distancing is going to flatten that curve. I think we're getting to it sounds like from what I'm seeing, we're getting to kind of the upstretch of that curve, so we're getting very close to that. Continuing to social distance will make it longer and will kind of flatten that out. And then there is always a concern that potentially down the line we may have an uptick in that, and especially that likely would happen if you were to stop social distancing and get large groups of people together. So that would be the concern, yes.
So to our viewers today, what is your best recommendation as a doctor?
Yeah, I mean, I think that right now people are doing the right thing, staying at home, doing social distancing, continuing to do hand hygiene, and making sure that you're using any equipment to keep you safe and keeping away from other people, quarantining if you have any symptoms, even if they're mild, and we'll take care of the rest.
Very good. Thank you, Doctor.
Great. Dr. Norman Sell, we appreciate you being here today. Thank you very much. You come from a family of public servants, and we appreciate you filling that fine family tradition. Thank you.
Thank you.
So, as we've talked about, having a great relationship with the state of Illinois is imperative during a time like this. Open lines of communications, having direct access to all the departments, whether it's the Illinois Department of Public Health or whether it's the Illinois Emergency Management Agency, all of those things are important. And that's why we bring to the table today Senator Chris Belt, who has been a great way for us to communicate with the state. And today, I think he brings some good news to the table. An issue that we've talked about for some time is testing. And initially, there were very few tests, a scarcity of tests in the area, and people were wondering, how can I be tested? When can I be tested? Eventually, there was a drive-up testing facility opened in Swansea. But now, Senator, I think you've got some additional news from the state.
Absolutely.
Well, and welcome, by the way.
Thank you for having me, Chairman. So yes, working with the governor and his administrators, Deputy Governor Newbern and Deputy Governor Flores, myself along with Representative Greenwood, we were able to get testing sites in East St. Louis. They will be conducted through Southern Illinois Healthcare Foundation, Larry McCullough / Touche. We do believe that the site will be on 8th and Missouri, the Windsor site. And also we're happy to announce that there will be a site in Cahokia as well, and quite possibly a site in West Belleville. Now, along with those sites, there will be rapid testing machines, which really will be good because you don't have to wait weeks at a time to find out your status. I think it's at the most 30 to 35 minutes. You'll be able to turn that around to find out what your status is. We'll have additional kits for current COVID-19 testing. And we're hoping to be able to relax the testing criteria so that we don't have to turn away possible potential cases away. And so we're really excited about that.
So it's important in those three areas specifically. We're seeing an uptick,
absolutely,
in the number of positive cases. So we want to encourage people to stay home.
Yes.
If having a barbecue and inviting a bunch of friends to your house, that's not staying home.
That's not staying home. And with this holiday, with today being Good Friday, and we'll transition to Easter. We have our traditions and we have all our religious activities. But it is of the utmost importance for us to continue to practice social distancing, continue to heed the advice of our healthcare experts and our governor, and we really want to stay at home over this weekend. And not just this weekend, but because of what this weekend is, really, let's stay at home and let's make a phone call. Let's for those with technology, let's FaceTime. But let's do it in accordance with the advice of the health experts.
And break the cycle of this virus in the community. So another one of the issues that we've had all along is being able to provide PPEs, personal protection equipment, to our first responders and to the medical community. Today we received a load here. Awesome. I know that you were you're big on calling Department of Public Health. Yes. and AIMA. Can you talk about the process you've got? So they have a lot of areas of the state that they're delivering to, and so you are able to call and use your office.
Yes.
To make sure that we're not forgotten.
Well, it all starts with communication, and as you know, Chairman, we do a weekly phone call. And then from that phone call, I'll reach out. I'll go through my networks, through the Senate, and I have the two best representatives that do the same thing through the House. LaToya Greenwood in the 114th District and Leader Hoffman in the 113th District. And I think that the fact that we all push and move in the same direction, we're able to get some things done. But it all starts with the communication.
So a lot of things are shut down.
Yes.
State government is not shut down.
State government is not shut down. Now, we may not physically be in Springfield. Our offices, our district offices are shut down, but we are not shut down. We still get our messages. We have our messages retrieved off of our district phones. My phone number is 618-875-1212. You can still call that number. You can still leave your concerns, your questions, your suggestions, and those come to us. But in beyond that, we still do caucus calls. We are part of committees. We still do our working groups. I'm a part of a pension working group. I'm a part of energy working group, and I'm a part of an economic revitalization post Corona. And so we're working all the time, and that's in addition to the emails that we respond back to from constituents and other organizations and things like that. We are not shut down. We're working every day.
And we're going to need to be putting our heads together on
Yes.
economic revitalization.
Absolutely.
Because our economy locally has pretty much shut down.
Yes.
A lot of bars and restaurants and businesses have all ceased to operate simply because of the virus.
Absolutely, and we really want to pay close attention to, while all business matters, we want to make sure that we look and look out for the small business. We want to make sure that they come back after Corona, post-Corona, and so the governor and his administration, they've done a yeoman's job of working along with the federal government and with the CARES Act and coming up with some economic initiatives to look out for our small businesses during these times.
Great. Senator Herb, do you have anything?
Yes, Senator, as we talked when you got here, we did get the shipment in today, and we really appreciate that.
Thank you.
When we're on those weekly calls, you're a voice to be reckoned with, and we really appreciate that. And I was happy when I mentioned to you today that we didn't receive the gowns that we had
Right.
requested. You picked up the phone
Right.
and said, hey, I'm going to track them down. So, and that's what's good, Chairman, and, where we have those communication lines, and we really appreciate that out of the Senator.
Thank you.
Because a lot of these items go to long-term care facilities.
Yes.
And those are places where they can become hotspots if the proper PPEs aren't available, and so we appreciate
Thank you.
your efforts,
Thank you.
Senator. Thank you for coming in
Thank you.
today. Herb, you ready to
Very informative, I
Wrap
can
it
tell
up?
you that.
Very
Real quick,
much
we're going to wrap it up on the EMA side. Our morning call at 8 o'clock with the hospitals and the EMS agencies. More networking, a lot more information being exchanged every morning. Assistant Director Brian Whitaker gets that early morning duty to do that. Conference call with the original EMA agencies. Had one this afternoon. We'll be scheduling it with the EMA Deputy Director. That's always an interesting one, talking to him. And at 4 o'clock, Chairman, we had the Governor's conference call. So it continues to go on and on. We talked about the taking the 2 pallets. You heard Candace, our PSAT manager, talk about the calls. They're slowed down. People are still calling about gatherings. We're going to continue to make sure those get routed to the proper authorities. As you heard the senator say, you heard the doctor say, we want you to stay home. But this is something I want you to think about, and every day I get to wrap this thing up. Just, if you've got a loved one that ends up sick in the hospital, just remember, you're not going to be allowed to be there with them. If that loved one ends up dying, passing away, you're not going to be there with them. So do everything you can to stay home and stay alive. We'll see you back here in just a little bit with our Spanish ladies translating this into our Spanish communities, and we'll see you tomorrow afternoon around 3:30. Thank you.